Okay, Mike, this is a little bit of a quick assessment on how to look at what factors are contributing to patella tendonitis. Okay, so you're going to have them lying supine on the side of a table, and they're going to grab their foot, as you can see, and then hug the top. Now, someone who has a over-contributing vastus lateralis and tight hip flexor will go out to the side and shoot up. Okay, so if you look down the line there, it'll shoot up rather than just put it straight. Be straight and down. Okay, so that means tight rectus because you're in hips split position. Okay, how you would stretch it is basically come over to the side, hold this leg back, and with the other hand just push this leg down and make sure it's medial. Okay, that's the first one. You can sit up straight, right? Both legs on the table. Next thing is going to look at patella mobility, right? So if this is their affected leg, check lateral and medial glide of the patella. If you feel a lot of stiffness to one side, then some IT band work may be needed. Some lateral gastroc work may be needed. The other thing to do is check glide, both inferior and superior. You should have a little give, as you can see my fingers gliding the patella. You may get stiffness and stiffness to the top, so then they're going to need a little bit more quad tendon and a little bit of patella tendon, just light cross friction to kind of loosen it up. Okay, those are two things that basically I use. The other one, go prone, heel to your butt. The other assessment, kind of stretch for rectus. Split position again. He's going to take a big Spider-Man step up with the left leg. Good. Facing down on the table. And then you're just going to simply check how close, I'll grab how close their heel can get to their butt. So now that's pretty tight, but I know he's cold, right? And then you can stretch them in this position as well. You can go medially, right, and push the foot to the butt. You can go laterally a little bit, push the foot to the butt, or go straight back. Okay, you'll take the position of going right on their side and then asking them for feedback and how close they can, or how much you can push, and make sure that their glute is firing when they do that to get a little bit more stretch. I think that's it. If I have to add anything else to it, I will, but those two things will help kind of alleviate some of their patella tendonitis. Okay. Okay, Mike, of course I did forget a test. So now this is just simple ankle mobility rocking, and you can use it as a little bit of a diagnostic. So you want to make sure that their heel is down and that their knee is gliding forward without the heel popping up. Okay? And I would say Brian's got really good ankle mobility. Brian, just show some bad ones. What we would classify as a bad one that we would see. So their heel would rise up, or their foot would never get past the laces, even if their heel stayed down. So you can do some rocking to kind of mobilize that, without getting your hands on them. The other thing is to roll the bottom of the foot. The other one is with a foam roller. Brian, grab a foam roller. With the foam roller, you can do kind of the Kelly Starrett mobility wad, gastroc smash. Yourself, you can stack, go at the Achilles and then work your way up, but just cross the leg over to add some more weight and pressure on it, and just go side to side to help loosen them up. Now obviously don't forget the ball for the plantar fascia. And the other one I would say that, Brian, just jump on the table. The other one I would say that they can work on is, we'll go this foot up, heel down, sorry. Oh, the foot flat. So their foot's flat with the knee bent. Like that. Yeah, foot flat with the knee bent. Okay, and then you can kind of go around to the peroneals and get your finger placement right behind the knee. And you can they can do it too, but you're just going lateral medial. You'll feel the tissue, and they'll tell you where hot spots are. You can go lateral gastroc behind the fibula head, right? So find fib head, go behind that high part of the gastroc, maybe a little tender and tight. Okay, if that fibula head's not gliding in ankle flexion or in dorsiflexion, then you could get a little bit of patella tendonitis. So try those couple as a warm-up, and then see how their movements are, the movements that promote some sort of patella tendonitis, so you can recheck and see how they feel. But I'm guessing with the age of that operator, you will get a lot of relief, especially if he's foam rolling quads and high rectus. Okay, one more stretch I will add actually is kneeling hip flexor stretch that he should be doing, pulling his heel to his butt on his own pad underneath the knee, and then he's going to make sure he's drawn in and glute on his stretching side. His left side is firing. Yep. Okay, so if they can do a lot of those, it can go 3 10-second holds or whatever.